energy efficiency and healthy homes. This is Barb Gottlieb speaking. I'm the director of PSR's Environment and Health Program. You know, I love October. Halloween is coming, the weather is getting nippy. That makes this the perfect time to think about energy efficiency. Here at PSR, we often talk about energy efficiency as a means of reducing fossil fuel pollution. And you know, that's a critical point about energy efficiency, but it's not its only benefit. Energy efficiency can also have strong effects on health. For example, energy efficiency measures can improve indoor air quality, eliminate extreme heat and cold in the home. That in itself can reduce asthma-related hospitalizations and emergency room visits, as well as missed school and work days, while also providing safer, more affordable housing for families. Now that's a pretty significant list of health impacts. Our speakers tonight will talk about how energy efficiency programs achieve those benefits in practice. And they'll also present some leading research on the link between energy efficiency and healthy homes. Further, they'll tell us about some of the promising opportunities to support preventative health care in this form of safe, efficient, and healthy housing through integrated housing intervention models. We're going to kick off with Sarah Hayes of the American Council for an Energy Efficient Economy, known as ACEEE. She'll provide some context for this discussion and remind us what energy efficiency is. Then we have two speakers from the Green and Healthy Homes Initiative who will describe how we strengthen that link between healthy housing and healthy families by improving energy efficiency in the homes. So let me move ahead and do that formally, introduce our speakers. Next slide, please. Our first speaker is Sarah Hayes. She's a senior manager and researcher for air and climate policy at ACEEE. She brings over 15 years of experience to their federal policy team. She leads ACEEE's work on clean air and the environment, conducting analysis of national policies and proposed regulations. Sarah also manages a research team focused on emerging regulations and opportunities to use energy efficiency mechanisms to reduce pollution. Prior to working at ACEEE, Sarah worked at a boutique Wall Street law firm where she advised clients on transactions in energy and environment markets and emissions trading. In addition, Sarah worked for the Ozone Transport Commission as a private consultant and has authored a number of published articles and books on incentive-based environmental policies. She holds a Bachelor of Arts in Environmental Studies and a law degree from Fordham Law School. And for those of you who've been following PSR's work on energy efficiency, you'll know that Sarah also collaborated with us on an earlier webinar on energy efficiency. She was also the lead staffer in our collaboration with ACEEE to produce our handout on energy efficiency and health. So Sarah, welcome back. Next slide, please. We also have two speakers with us tonight from the Green and Healthy Homes Initiative. I'd like to welcome them and thank them for being here with us. We've not collaborated with you guys before. Wes Stewart is their Senior Director of Technical Assistance and Legal Services. In this role, he provides national technical assistance on program design, management, and implementation to a number of the Green and Healthy Homes Initiative sites, as well as their program with HUD, on lead hazard control. He also provides trainings to owners, tenants, realtors, insurers, attorneys, and government agencies with a special focus on lead, reduction of lead risk in housing, lead poisoning prevention initiatives, and other of the Healthy Homes program designs. He has also served as their program manager for weatherization and energy efficiency programs, family advocacy, and legal services. And finally, he's their regulatory affairs expert and chief training provider. Prior to joining Green and Healthy Homes Initiative, Wes was an attorney in private practice in Baltimore. He holds a law degree from the University of Baltimore School of Law. Also with Green and Healthy Homes Initiative is Brendan Brown. He now serves as their Senior Associate for Research, Policy, and Environmental Health Science. He leads their research on the impact of healthy homes and weatherization interventions, cost benefit and cost effectiveness of their model, and also opportunities to connect Green and Healthy Homes Initiative services to the healthcare and education sectors. Um, he holds a Master's of Health Science and Environmental Health from Johns Hopkins Bloomberg School of Public Health, as well as a Risk Science and Public Policy certificate. He also has 10 years of practical housing experience in the private sector as owner and lead finish carpenter of a residential restoration company in New Orleans. So let me now turn the floor over to Sarah Hayes at ACEEE. Sarah?
Thank you, Barb. Can you hear me all right?
Yes, indeed.
Okay, great. And I am going to make my portion pretty short here because we have a lot of content, and I'm excited for the opportunity for us all to dig into the links, the health links of energy efficiency. The way that I have approached a lot of my thinking about energy efficiency and the environment has been from an ambient air perspective, more about the outdoor air quality impacts of efficiency. If you're looking at the slide, what is energy efficiency with the light bulb there, we throw the phrase around a lot and often forget to define it. Energy efficiency broadly just means getting the same level of services for less energy, or improving the level of services that you're getting for the same energy. And when ACEEE talks about energy efficiency, we further refine that definition to be focused on end-use energy efficiency. So you can improve the efficiency of a power plant so that it produces more electricity for the amount of fuel it consumes, and that is a kind of energy efficiency, but kind of outside our realm. We really focus on at the point at which people are consuming the electricity or the natural gas or whatever form of energy it is. So that would be in your home, in institutional buildings like schools and hospitals. It would be in cars, in the way that communities are designed. And today we're going to focus a lot on homes, residential buildings. And when you go into one of those buildings and you improve the efficiency of the building, a lot of the measures that you take have direct and indirect health benefits. And we'll get into that a little more. Next slide, please. This slide, community benefits of energy efficiency, I included this because I think it nicely pulls together kind of the ambient perspective, which is the far, kind of represented by the far right panel, and the indoor health perspective, which is the far left panel, and a bunch of things in between. So energy efficiency protects health in the home, which we will talk quite a bit about tonight. It improves the safety and comfort of the building. It saves money, making housing more stable and more affordable. When you reduce the costs of energy burdens for families, it creates jobs and opportunities in the communities they live in. And when you burn less from a power plant, you protect the environment. Next slide, please. I'm not going to read all of this, but if you want to come back to the slides later and take a look, this is a snapshot of some of the environmental benefits that accrue when we do energy efficiency. Next slide. This is one estimate of the number of power plants avoided by energy efficiency, and I include this not because I think it's definitive, but rather to give you some idea of scale, what role energy efficiency has been playing in the past and could play in the future in terms of reducing pollution. Next slide, please. And into the future, if we want to get serious about achieving climate goals, that green wedge there is the federal government's estimate of the role that energy efficiency should play. So it's no small chunk. If you look at it there next to renewables, I think renewables like solar and wind, they get a lot of attention, as well they should. They're very promising technologies, but I think oftentimes we don't recognize the important role that energy efficiency has to play. Next slide, please. This is my last slide, and I'm not going to get into all the details here. I really just included this slide so you could get a sense of, you know, these other slides I showed were kind of national snapshots, and this is some context of the role it could play in some select states. We didn't pick these states because they're the most promising states. In fact, we picked them because there's some states where there may be some political controversy about reducing greenhouse gases. And what we did here was we said that blue bar is what percent of the state's carbon reduction goal, which was a goal established by EPA, could be achieved through energy efficiency. So EPA has proposed the Clean Power Plan to regulate existing power plants, and it's set an individual goal for each state. And we said, well, how much of those state goals could be met with energy efficiency? And we were pretty conservative on the energy efficiency. We weren't like pie in the sky. And you can see for some of the states, almost the entire goal can be met through energy efficiency policies. So it's an important tool in our toolkit for reducing pollution. I just wanted to say some of that to put it in perspective, big picture. And now for the rest of the call, we're going to hone in on what is its impact, environmental and health, actually inside somebody's home. So if you participate in an energy efficiency program, what is the benefit that accrues to the participant in that program? And that's all I have.
Okay, well, thank you, Sarah, for that grounding and that reminder of what energy efficiency is, some of the different ways we think about it. And as you were saying, we'll move ahead now to our presentation from our guests tonight from the Green and Healthy Homes Initiative. Can we see Wes and Brendan's slides, please?
I'm here, Barbara, and
well, that's good. Wes, welcome. That's a good start.
This is Brendan.
Yeah. Oh, that's Brendan. Hello.
I think you have to send me something to let me share my screen. There you go. So we should be able to see my screen now.
Here we go. Yes, indeed.
Okay. And so, good afternoon, everyone. I'm Brendan Brown, and we'll be joined shortly here, or we'll hear shortly here from Wes Stewart. I'd like to thank Barb and Julia for helping us put this webinar together. And well, I'm the Senior Research Associate with Green and Healthy Homes Initiative, and I'll be speaking to you today because we spent the last year doing some pretty extensive research on the intersection of health and energy efficiency. And we had a paper that a publication we put together for the ACEEE summer study in August. And a lot of this is from that paper, which was called Non-Energy Benefits of Energy Efficiency and Weatherization Programs in Multifamily Housing, the Clean Power Plan and Policy Implications. So we're not going to limit the conversation to multifamily, but a lot of what applies to multifamily housing also goes for single-family affordable housing as well. So we're going to start off with the value proposition for energy efficiency, and I think it's important to follow up on what Sarah said, that energy efficiency, particularly from the demand side or in end use, is important, especially for the Clean Power Plan and where states put their efforts in as much as we like renewable energies, that's not the only solution, as a lot of her charts showed you. And the reason we at Green and Healthy Homes think that it's really important to use this kind of advocacy and research is to show that there is a burden of energy efficiency and unhealthy housing in the country that makes it so that certain segments of the population, particularly working class and low-income households, are faced with not only a housing burden, but also an energy burden that can be one of the more significant cost drivers of the housing burden they're experiencing. In fact, we see that on this first slide here, that low-income households can spend up to 20% of their income on monthly energy bills compared to 3.5% for median income households. We also see that there's 9 million families that live in unhealthy homes across the country. So not only do families face affordable housing crisis, but also a lot of them have to live in poor quality housing as well, which has its own associated risk and health hazards. This is a updated kind of estimate, but showing that billions of dollars are lost annually due to these kind of housing associated costs, up to 132 billion or 4.3% of total U.S. healthcare costs. And this is 50.9 billion due to lead poisoning. Also, we see significant costs related to trip and falls, which is is around 19 billion in this estimate. I think it was 2013, but will be projected to grow to around 31 billion. This is in part because of a demographic shift to more aging population, as well as increased healthcare costs. We also know that asthma is a significant housing burden, and so this affordable housing crisis and kind of lack of safe and healthy, energy efficient housing affects particularly, like I said, low income and in particular renters, because this is moderate to severe housing burden. We see rates of 53%, whereas among single family housing, it's more around 36%. But again, these low-income households are more likely to have older appliances that are less energy efficient, more energy-intensive heating systems such as fuel oil, or older systems that are more dangerous in the sense of the air quality. And again, that of the households in the country, we're seeing that about 7.7 million were classified as having worst case housing needs, and this is where the person has a below 50% area median income, and they have a rent or housing burden greater than their 30% of their income. And for a lot of families, it's a severe housing burden, which is greater than 50%. Again, so what is part of the solution? We believe part of the solution is, weatherizing these houses that actually need weatherization the most. And we saw recently they have released the National Evaluation of the Weatherization Assistance Program, and they did kind of cover two periods, 2008 and 2010. A lot of what we see here is the savings investment ratio on 2008 houses, and this was significant. This is just the energy savings, and you still see in multifamilies it was about 1.82, and in single families it's about 1.72. So this shows that in both types of housing stocks, there are significant energy savings to be able to show there's a return on investment. Now the important part is this is not including all these other non-energy benefits, which we're going to kind of go over here. But what they showed is that there's also reduced asthma symptoms, lower ED visits and hospitalizations in those houses that are weatherized. You saw improved school and work attendance, reduced thermal stress, reduced cases of carbon monoxide poisoning and fire mortality, and also improved mental health and physical health. As well as less trade-offs and better energy security, specifically around budget issues related to where the kind of household expenditures are directed. On that, I'm going to kind of go quickly over the non-energy benefits. We talked a little bit about energy savings, but these are just the wider socioeconomic outcomes that arise from doing energy efficiency work. A lot of these, they also are known as multiple benefits, co-benefits, non-energy impacts, and net benefits. When in the energy world, we kind of sit, I'm a public health practitioner, but what we find in the energy world is they've done a really great job of kind of doing these almost, of evaluating the energy savings and being very efficient at, or improving houses and making them energy efficiency. But to this point, they've mostly concentrated on the energy savings and the kind of the outdoor environmental benefits, kind of this top pathway, as it were. Whereas we think there's a lot of benefits around the also, health benefits and also economic benefits that need to be part of that evaluation. And so there's a lot more research out there now and growing evidence. Just going to point out a couple. There's the benefits of energy efficiency in affordable housing. This was done by the EPA in 2011, but it shows, the top two are kind of what the evaluations have been concentrated on, and then I think there's some other areas that, particularly for doctors, right, in advocacy, going to your public service commissions and, making sure that they're counting, the health outcomes and these other economic outcomes. Because if they're not evaluated, then they're going to decide to reallocate their the resources based only on, the total cost of the programs, but only on part of the benefits. And another partner of ours is Elevated Energy based in Chicago. They did another paper on non-energy benefits and multifamily housing specifically. But typically this is how it's broken up. You can break it up into societal benefits, where I said a lot of kind of the evaluation's been around, focused on, as well as utilities. Obviously utilities usually have benefits, but what we're concerned more about is especially occupant health down here, because we really think that it has there's health improvements and financial stability, specifically around housing stability, as well as some benefits for owners. Now, the important thing as an evaluator, for me at least, is then kind of thinking what are some of the long-term outcomes. And what I think is really interesting about energy efficiency and weatherization interventions is that, at least in the logic model and framework that we've developed in our paper, is that you can link the non-energy outputs such as air quality, improved health, and improved economics, and their kind of non-energy outcomes to the social determinants of health. Basically these are the 5 major underlying factors: economic stability, neighborhood and built environment, health and healthcare, education, social and community context. There's as far as research around residential housing and health, there's known to be 3 interrelated aspects, specifically the conditions of the home and environment, conditions of the neighborhood, and housing affordability are directly linked to these social and physical determinants of health. Again, on this next slide, just kind of highlighted some of the areas that we think energy efficiency and weatherization work directly links to. Some of these, some people might wonder how is it related to crime and violence. It is Lead Awareness Week, so that's going to be, we're going to give a few examples here, and since it's Lead Awareness Week, we thought we would start with this one. But lead poisoning is a major issue, especially lead-based paint poisoning. A lot of the news has been around lead in the water from areas such as Flint, but as we see in East Chicago, where it was a airborne lead contamination, but we still see that at the new CDC levels of 5 micrograms per deciliter, that there's 535,000 U.S. children every year that are above those levels. We know that this leads to a lot of mental and health and development problems, and specifically that it affects attendance and early development and basically early education outcomes. And what we see in this next chart is kind of a comparison of the long-term effects. So basically what we have is the average lead levels in preschool kids, and then I want to get it right, so 23 years later, the number of violent crimes per 100,000 people. And so you're getting to see a significant trend, and as these blood levels have gone down following some of the more significant lead reduction laws, you also have seen a significant drop in long-term violent crime trends. And they have smaller studies on that in specific areas. So, but we see from some of the research in Gould et al. That the lead hazard control programs, when $1 is invested, that you can see return on investment of $17 to $221. one of the things that's significant about, and we're bringing up lead poisoning, is because when you're doing energy efficiency and particularly weatherization of low-income housing, this is going to be something that you run into. So, and a lot of problems in weatherization programs is, first of all, there's not enough funding, so we obviously think that should be increased, but there's a lot of deferrals due to health and safety. So a lot of what we do is help cities and counties to leverage funds and basically braid the funds at a local level so that this work can be done. A couple other housing-related health problems I wanted to touch on are household injury. We think this is very significant, and as I said again with earlier, with the demographic shift to an aging population, we're going to have a lot more potential household injuries that could be prevented. As well as I wanted to touch on, we've spent a lot of time working over the last 4 or 5 years at Green and Healthy Homes Initiative working on asthma. We think this has a very good potential. It's a national problem. We see it in children and adults, and that we have very good evidence that the type of weatherization and healthy homes interventions can prevent asthma exacerbations. And let's keep going here. On that note, yeah, we also know that some of the other outcomes besides direct medical costs from asthma, and a lot of those are concentrated in high utilizers of emergency services, kind of preventable, potentially preventable emergency visits and inpatient admissions. But we also see other productivity measures, and this is some of the more interesting work I get to do as an evaluator, is kind of look across sectors. And you know, when we're doing housing work, where are some of these outcomes, you know, where are the benefits being realized? You know, so we have in the housing, trying to do public health interventions. In the housing world, we have what we call the wrong pockets problem. And this is, we do work in the housing sector, and then yet, you know, we see benefits in the healthcare or in, you know, attendance at school or work, and these aren't, traditionally haven't been stuff that was evaluated. So we are trying to change that. But we know these are two important outcomes. And we'll go to the next slide here. And with 25 million adults and children having asthma with a cost of over $51 billion a year, we think that it's a lot of this could be prevented by just following the already established guidelines-based cares, which has 4 major components, which is 1, the assessment and monitoring of disease severity and control, proper or appropriate medication use, patient education and environmental control, and also comorbidity control. So as a housing group, we think this is something that's very achievable and something that we could actually reverse or affect what is a social disparity in health equity right now. And a lot of the evidence is already there. The CDC has a Community Preventative Service Task Force, which did a meta-analysis and showed for every dollar invested, you have a potential of $5 to $14 return on investment. GHHI is leading 11 different feasibility studies on asthma in particular. And then I'm just going to go through real quickly, because I also want to let Wes talk on our specific GHHI model and how we actually, you know, the how of what we do. And but I do want to go through some of these slides. Basically, we had a framework in that paper, and these show some of the kind of like basically logic model direction, how from air quality you have health outputs and economic outputs. And each of these basically, you know, by reducing criteria air pollutants and reducing greenhouse gas emissions in this next slide, it shows that by doing this you improve indoor air quality, and then you also have kind of more macro environmental effects by, you know, improving greenhouse gas. The same thing with health outputs, you know, by improving fire safety, thermal comfort, indoor air quality, and reducing indoor environmental toxins such as lead or VOCs, which is volatile organic chemicals or radon, we can improve health outcomes. And also, these would then, in turn, impact some of the major social determinants of health, such as quality of housing, environmental conditions, health literacy, perceptions of equity, and early childhood education development, as well as school attendance. And to show the economic logic model here is that we also show that this has wealth retention for the families who participate in our program. We do have the program cost, and that is an economic benefit, especially if you hire local contractors from the community and you employ your workers there. Also sector transfers, so kind of less investment in renewables or in distribution or in more into communities is a better thing in our mind. And so these also have direct economic outcomes, which then in turn also have macroeconomic effects. But the important thing is that it brings economic stability to communities, and this reduces poverty, increases employment, and most significantly, housing stability increases with these kind of programs. And real quick, I'll talk about, I said that some of the problem is not getting these programs properly evaluated, so that's what I spend a lot of my time in. Kind of from what we've learned, one of the main things is obviously getting the right research project partners. In Baltimore, we have an asthma program we've been running for about 20 years, and so we had, we had done studies and done pre-post surveys, and but now we have gotten funded for a Healthy Homes technical study funded by HUD. But just to show, it's a cost-benefit analysis, and we are using energy, weatherizing homes and providing health education around asthma, but we're trying to show, here is that you need a lot of partners to do these kind of cross-sector, look at all the different outcomes. And so here we have UMBC, and they're important because they are the Medicaid researchers who look at all the claims data for us. We have Hopkins, who's providing expertise on the biostatistics and kind of the clinical expertise. And then we also have lots of partners that we get data from, like BG&E for the energy data, as well as Baltimore Neighborhood Indicator Alliance is how we're getting school data. And just to finish up, the cost-benefit analysis is basically trying to show a net benefit, and we're looking at the child's benefit in terms of missed school days, health status, as well as caregiver benefit, which has to do with the energy cost and their missed days of work. And then we'll minus basically the simple program cost, and we will that's the cost-benefit analysis. And we think that we need more of these type of analysis, and it should be included in the kind of state-level assessments of these energy efficiency programs. And on that note, I'm going to hand it over to my colleague, Wes Stewart, so we can have time for questions at the end. Okay, Wes,
thanks, Brendan.
Yes, sir.
Okay. Good evening, good afternoon, depending on where you are in the U.S. We just all want to make the folks aware of also some interesting aspects that are going on around energy efficiency and weatherization, both in the single family and also the multifamily sphere, in terms of the weatherization program by DOE, utility-funded programs, LIHEAP programs, and that is the aspect of not only the non-energy benefits being realized specifically from energy efficiency and weatherization, but also how can we integrate other resources and innovations to generate even greater benefits, both on societal, financial, health, educational, et cetera. And so in 2009, we developed a model, the Green and Healthy Homes model, in cooperation with DOE, HUD, and CDC, that brought together an integrated program to actually couple weatherization, energy efficiency, rehabilitation, lead hazard reduction, and other healthy homes interventions. And part of that reason was to address the deferral issue that Brendan mentioned previously in terms of hazards that actually reduce the ability for families to get into energy efficiency programs that get deferred. Next slide, please. And so the process that's been developed is being implemented in 25 locations around the country in terms of green and healthy home sites is to have a comprehensive assessment where there's an educator that educates on health-based hazards in the home, educates on how to utilize the energy efficiency measures that have been put into the home, and also does a full energy assessment and energy audit to assess the house for the energy loss, but also for other home-based environmental health hazards. Next slide. And from that process, there's developed a comprehensive scope of work. That scope of work includes an energy audit-based scope to address all the energy loss measures in the home, but also looks at what are other components to actually allow the weatherization work to be done, to make sure the energy benefits are realized, but also to address these home-based environmental health hazards. Brendan before in terms of household injury, lead poisoning hazards, but also around healthy homes in terms of asthma triggers, household injury risk as well. Next slide. How that works is weatherization programs are leveraged together through a braiding system of combined funds from public, private, nonprofit organizations to address weatherization, lead hazard reduction, rehabilitation, and more particularly for this group, healthy homes interventions. So that is a huge area of lack of funding nationally. There's very little healthy homes funding available to address things like household injury, mold, radon, asthma triggers. There are fundings oftentimes to test for radon, asbestos, and mold, but very little remediation funding. So this model is actually generating additional funding to leverage with weatherization to address these common triggers and common hazards we find in homes. Next slide. That is producing dramatic results for families who are not only realizing energy efficiency and reductions in energy consumption, but are also having exponential results in terms of health outcomes that are improved: school attendance, work attendance, increased financial security. One quick example is a family was in Baltimore. This is a Smith family. It was a family of 4 who resided in a one-story home. And the family came in to receive energy efficiency and weatherization and also to address lead hazards. What was interesting about that case is they came in for typical weatherization and energy efficiency services, but their main need was actually a child who was being hospitalized 3 times a year for very high asthma issues in terms of being hospitalized asthma, costing about $48,000 a year. And through this coordinated approach, we combined weatherization with lead hazard reduction, healthy homes to address asthma triggers in terms of mice, dust mites, lack of any poor indoor quality, and actually a lot of VOCs that were causing asthma irritants. And through that combined intervention, we were able to address and dramatically reduce medical costs. The child hasn't been hospitalized for over 4 years following the intervention, but also those energy cost reductions and savings of $700. Where we're seeing the coupling of energy efficiency with other housing interventions, we're seeing just much more dramatic results. Next slide, please. In terms of how this is being effective on a broader scale outside of individual families, in a cohort of 200 families in Baltimore using this model and this comprehensive approach of energy and health, we were also able to achieve substantial reductions in hospitalizations, improve school attendance, and improve work attendance for parents. Next slide, please. And those results are also mirrored through other university research and data collection at our Philadelphia sites and also our Cleveland sites where you're having that comprehensive approach. So our main thing to make folks aware of is, in addition to the direct energy benefits and health benefits that come from energy and weatherization, we're seeing a much more powerful model where that's also coupled with other housing resources through local green healthy home sites and other models. So those are just things we wanted this group to be aware of. Last slide, please, Brendan. And another aspect is a lot of this work is generating new and innovative funding sources. One of those in particular is Pay For Success funding, which is directly has the opportunity to fund, again, that funding gap around asthma triggers. And so we believe that work should be done in conjunction with weatherization and energy efficiency to really stabilize homes so the children who receive interventions for lead, for asthma, are also staying in a home that's been made safer. So really think there's a lot of benefits to not only reducing energy loss, but also coupling health together to make sure the families remain in stable and safe housing. And so the Pay For Success opportunity is really one of those innovative funding sources that could pay for that and lay the groundwork really for Medicaid-funded housing interventions for asthma and energy efficiency. The reason we also think it's important for this sector is a lot of that work we anticipate being done by the energy auditors and the weatherization and home performance field who's performing that work as well. So I'm going to stop there and also go to questions in terms of for Sarah or Brendan or I.
Well, thank you very much, Wes, and thank you, Brendan, and thank you to Sarah. We will open up the floor for questions. I have a few that I have here for you. Why don't we start with this one? It says it's not surprising that there is money to identify problems like mold or asthma, yet not money to address these problems. How can doctors help? I think perhaps either Wes or Brendan, you might have reflections on how you do, or perhaps you don't, interact with health professionals in the communities where you work on the ground. And also, Sarah, I'd like to invite you, if we can extend that question to more specifically weatherization and energy reduction questions. Any thoughts from you about how might health professionals get involved on these issues and bring their medical knowledge and expertise to bear on helping to bring forward solutions?
Two quick responses. One is the fact that healthcare providers are often our partners in many of our cities and jurisdictions where they directly refer families with asthma, sometimes high medical utilizers as well, kids who have lead poisoning, lead levels. So through this comprehensive approach, we will assess the house for all the needs, and so healthcare providers and physicians are certainly a part of that referral network. The other aspect is we'd love for folks to also advocate for Medicaid changes. Many state Medicaid offices are right now considering whether to fund direct housing interventions to address asthma. The idea is the physician would, for a Medicaid child who is an asthma diagnosed child, they would be able to write a script to address home-based environmental health hazards where there's currently little or no funding for that. So that's an opportunity also to potentially advocate for that with Medicaid, who sometimes views that as just a housing issue, even though we know in many cases environmental triggers are a substantial factor in the asthma episodes.
Thank you. Sarah, anything to add there?
I would, I guess, just add that I'm really optimistic that some of the models that were just described are going to be coming soon to a city near you. I think we've got some good examples of programs that are successful, but my hope is that we'll see that it'll be a lot more common. I will also say that every state and many communities can avail themselves, their residents of those communities can avail themselves to either their utilities, energy efficiency program for weatherizing their home, and or a federal program. Federal programs tend to target low-income, at least many of those programs tend to target low-income households. They're not necessarily linked to healthcare, but if you are aware of those resources, they might be something you could refer your clients to as a healthcare provider.
Thank you. Here's another question. It says, where does industry stand on energy efficiency? Are they for it or against it, and why? I'd like to take a crack at that.
Yeah, this is Brendan. I would say, for the most part, industry most probably would be for it, because when you have investments on the demand side of energy, like on energy efficiency in the residential side, what you're going to do is lower the overall use, which has benefits because you have less peak loads. These are when you can have peak pricing and inefficiencies in the system that affect the industrial sector more than the residential sector. Because industries lose business when there's power blackouts, more so than residents. So there's some direct benefits for that. You'll see one of the things that we know, and at least in our research, there's a lot of research around the commercial sector already kind of, using these kind of energy performance contracts. This is widely used in the commercial sector already. So a lot of the industries are already applying the energy efficiency measures themselves. So at least in that sense, you would think they would be for directing investments to the same type of energy efficiency measures.
Can I just add a little to that?
Please.
This might be just saying it a different way, but in my experience, many industry representatives are the first or early adopters of energy efficiency, because if you can make your product for a lower cost, you have more profit. That said, I don't know if you meant to include utilities when you use the word industry, but utilities are not necessarily, electric utilities are not necessarily supportive of the efficiency, because in many states they make a profit based on how much volume they sell. So if you're reducing the volume of electricity consumed, that could cut into their profits, and so may not be appealing.
Thank you for that. I have a question actually of my own. I've been talking about programs that have some federal support. You mentioned the Department of Energy and HUD, Housing and Urban Development. I have heard about another program, which is the program proposed by the EPA, the CEIP program. Can one of you talk a little bit about that program and what it does for energy efficiency for low-income families?
I've been doing a lot of work on that, if you want me to take it.
Sure.
So the Clean Power Plan, which I mentioned earlier in my presentation, is EPA's rule to regulate greenhouse gases from existing power plants. And as part of that rule, they have proposed an early action program where, and that's the program Barb was referring to, the CEIP. And if you invest in renewables or efficiency in the 2 years prior to the compliance period, you can get credits, you can get allowances or ERCs, and those are the compliance vehicle for the rules, so then you can sell those credits and create a funding stream for your project. And as of right now, the proposal is that low-income investments in low-income communities would be rewarded at double credit. So if you reduced 1 ton of emissions in a low-income community, you would get 2 credits instead of 1. There's been a lot of excitement about that program because it could be a revenue stream to incentivize new investment in those communities.
Great, thank you.
Yeah.
I should say at this point, oh, I'm sorry. Did you want to go ahead?
Yeah, well, this is Brendan. I was going to just add on to what Sarah was saying. I think this is a very important part of the Clean Power Plan and something that they could advocate for in their own states, because each state's going to get to set how they're going to reach their goals. And you know, one of the charts Sarah showed earlier is that most states could easily make it with energy efficiency measures on just the demand side. But you have states that might just invest completely in renewables, and so you would lose that on this important opportunity. There's also part of energy efficiency for all, both ACEEE and Green and Healthy Homes Initiative, and this is a cross-sector collaboration working on those type of issues. So.
And one of the things to be aware of, especially for Physicians for Social Responsibility, is that both the industry and also the public service commissions around the country, we're also trying to educate and help them understand these other benefits to make the case for energy efficiency weatherization programs, that trying to justify, have an even greater return on investment. We think that these other non-energy benefits are so critical to also help make the case for additional funding to policymakers as well.
Well, I'm glad you mentioned that. One of the things that I haven't referred to on this call is that, of course, PSR not only does work on climate change and related energy issues, but we also work on environmental toxics and a lot of the things that you're talking about in terms of the challenges to health that people are experiencing in their own homes are exactly these environmental toxics. So I think that there'd be broad interest on the part of PSR in your program, and again, not just from the energy perspective, but also from this larger perspective of healthy homes. So perhaps that's an issue that we'll want to come back to. Let me mention now that I actually lost a web connection during our webinar, and so I cannot see the question box. Julia, can you take a look for us if anybody has written in any questions? Would you be so kind as to unmute yourself and read those questions to us? Well, I'm not sure if perhaps we've lost Julia. It's been a slightly complicated webinar for us technologically speaking today. But if there are no further questions, it's getting on towards the top of the hour. We're a few minutes ahead of time, but we might just wrap it up. So I'd like to thank Brendan Brown and Wes Stewart for being with us, and of course Sarah Hayes, and all of you who are with us in our viewing and listening audience. And thank you very much, and we'll bring the webinar to an end right now. Thank you very much, and good night.
Thank you, Barb.
Barb.
Thank you, Barb. Good night, everyone.